So we already knew that this big, beautiful bill was going to have a devastating impact on some of our nation's poorest, especially rural hospitals. But it looks like this bill has already claimed its first victim. I'm just reading to you here from a statement from the president and CEO of Community Hospital in McCook, Nebraska. He says, "Unfortunately, the current financial environment, driven by anticipated federal budget cuts to Medicaid, has made it impossible for us to continue operating all of our services, many of which have faced significant financial challenges for years." And he's warning of additional hospital closings. The bill hasn't even been signed yet. Folks, this is why my team and I are starting a grassroots news organization, because there are going to be a lot of stories like this in the coming months, and they need to be told. Because when a hospital closes, it hurts everybody. The elderly, it takes away life-saving access to care for pregnant women. But here's the thing, it's probably going to be happening in parts of the country that don't typically get a ton of media coverage. So if you're hearing of people losing their health care, mothers caring for sick children, hospitals that are closing, folks are going to lose their health insurance. And we want to hear from you, because the truth is that there are already a lot of people in this country going through hard times, but those hard times are about to get a lot tougher. So please reach out to us if you know stories that need to be told. You can reach us at info@getrealnews.org, or you can even reach me personally at heidi@getrealnews.org. Thanks.
Nebraska clinic closes. Yeah, a clinic has already closed, knowing full well of what is coming with the big bad Republican bill. When it does finally pass today, it's going to devastate these clinics across the country, and people in rural areas are going to have no access to health care. It's going to be extremely difficult as hundreds of these locations across the country close. And it's happening because Republicans voted for this. Republicans did this to Americans. So you will struggle now. Millions of you will be without any health care. Millions of you will be without health care facilities to go to. You'll have to now drive out of your way some 40, 50, 60, 70 miles or more, because these clinics are going to close because of the Medicaid payments. That's right. This is brought to you by Republicans. You have no one else to blame. Republicans are doing this, and clinics are starting to close already. This is a shame, and it's going to affect millions of lives across the country.
Did you all hear about the hospital in Nebraska that is going to close down because of uncertainty about funding? This is honestly super concerning, especially because this small hospital is in a remote area, and for many folks, it's the only one that's accessible to them. And what we are seeing here is what many are expecting to be the first example of what the cuts to public funding are going to do to important services that people need. A lot of folks that are hearing about this, though, are not showing empathy, because in many ways, Nebraska voted for this. And in that county specifically, they voted overwhelmingly for the person that is promoting the cuts that are happening right now. Unfortunately, this is another example of folks voting against their interests, folks that were expecting that their living conditions, their livelihood was going to improve, and the opposite is happening. And listen, y'all, I understand why a lot of folks don't have empathy, but I feel bad for these folks, because the system that we're living in over and over again keeps hurting the folks that are the most marginalized. But those are my thoughts, familia. I want this to be a conversation. What do you all think about this? Do you agree with what I said? Or are you on the side that doesn't feel any empathy for these folks? And if you are somebody that lives in Nebraska, what do you think about this? This is crazy.
Today, a clinic in rural southwest Nebraska is announcing that they are closing their doors, and listen to what the CEO said is the reason why. Unfortunately, the current financial environment, driven by anticipated federal budget cuts to Medicaid, has made it impossible for us to continue operating all of our services, many which have faced significant financial challenges for years. This is the Community Hospital CEO, Troy Bruntz, said in a statement. And unfortunately, this looks to be the first of many. It is estimated that over 190 rural hospitals and clinics are in immediate danger, if this bill passes, of not being able to keep their doors open.
And just what I said would happen, happened. In the southwest Nebraska, in Curtis, Nebraska, a healthcare clinic is shutting down before the big beautiful bill even passed. And all due to financial problems, and especially motivated by the big beautiful bill and the cuts to Medicare that are going to happen. Curtis, Nebraska is a town of 900 people who now just simply won't have a medical facility left for them. Anyone who even attempts to make the argument of things like, oh, universal healthcare would cause us to have massive lines and no one to be able to get healthcare, They sound ridiculous now. I mean, we literally have the most privatized healthcare in the world by far, not even close, pretty much no public sector at this point, and they're literally closing down hospitals. Forget the lines, there's not even a building anymore. When Republicans say America first, they don't mean Americans, the normal citizens. They mean the American rich, because those are the only people who are going to profit from these changes that are happening right now.
Now they are facing the consequences of their action, and there is nothing much we can do, because the black folks actually warned about this, and I think that Nebraska is actually getting what they voted for, because they voted for deportation. They voted this government because of race, because they were warned about things that Trump is capable of doing. They were warned that the white elites actually don't care about anyone else except their profits, except their pocket. Look, Trump has removed the Medicare and the Medicaid, and this is affecting the health system. Now, the hospital that was close to Nebraska is actually closing. And I think also the shortage of workers that have been caused by the massive deportation of the Latinos will affect their farm, and they are likely also to go bankrupt in around 6 months. The price of groceries and farm products will rise up, but furthermore, Nebraska will make more laws, and they voted for this. Let's watch the videos, then I'll come back with more commentary. If you're watching us for the first time, please don't forget to subscribe, share, and like this video.
One concern about the Republicans' mega bill is its impact on rural hospitals. Well, just yesterday, the Curtis Medical Center in Nebraska announced it's going to close because of uncertainty around federal funding and, of course, inflation. The president of the Nebraska Hospital Association said this about the importance of Medicaid for Nebraska.
And where the rubber is meeting the road is how do they pay for that? How do they offset the cost of extending those tax cuts? And what Congress has put on the table is some substantial cuts in the Medicaid program. And Medicaid touches a lot of Nebraskans. It pays for 44% of the care for children in this state. It pays for more than a third of the births in this state. We all, I'm sure, know somebody who's benefiting from the program.
Nebraska is probably really pissed that they voted for Trump now, huh? Because everybody that's like, no, Medicaid's not going to close clinics and Medicaid's not going to close hospitals. Ask Nebraska how one of their clinics is now being closed. Why, you might ask? Because of Medicaid cuts. Because of Medicaid cuts. And that's just the first to downfall publicly. Imagine all the small ones that's going to close without the public knowing. And yes, my face is greasy because I got on sunblock because I'm about to get outside. But listen, I'm trying to tell you, it is about to get real ugly in America. Y'all just wait and see all you nurses and CNAs and LPNs and doctors. Yeah, you might want to go look for a new job because you're about to get terminated. Thanks to Trump. Go thank your president.
And it begins. A rural hospital in Nebraska closed, citing the upcoming bill that's going to cut health care for millions. And guess who won Nebraska in the 2024 election? Trump. So it's already hurting his supporters. It's like watching cows lining up to go to the slaughterhouse and them applauding it. Like, bro, make it make sense. It's crazy because, like, as long as they think it's going to hurt the others, they're okay with it. Oh, what the? Like, I'm lost for words.
I'm a doctor, and I can't believe I already have to say this. And if you don't think this is bad, I don't know how to help you. We have the first official report of a clinic closing because of proposed Medicaid cuts. This is a clinic that has been open for 30 years in a tiny town, and they've said we can't make money, and we know we're going to lose so much more because of these proposed Medicaid cuts, so we're shuttering our doors. And the hospitals in Nebraska have been advocating against this terrible, horrible budget bill because they know it will kill their residents. This clinic is in Nebraska's 3rd district, and Representative Adrian Smith is their representative in Congress. So I just want Mr. Smith to answer me, what's he going to do for these people who now don't have access to healthcare in their community? He has lots of things to say on his Instagram account about this bill, but not anything to say about how he plans to actually protect Nebraskans and access healthcare. Your mission, if you choose to accept it, is to go onto his social medias and go, what the heck is going on? Say no, this vote has not gone through yet, so there's still time. And if you're a constituent, you can go ahead and call him at this number and let him know that we've already seen harm and this bill isn't even in effect yet. Everything you do counts, so thank you so much and don't give up.
I just tried to call my representative's office. It's Mike Flood from Nebraska, and it rang and then they hung up, and then I called back and it said it was busy. And so either it's actually busy and everyone and their mother is calling him, or he's specifically avoiding my call, which I wouldn't doubt. But yeah, this big beautiful bill thing is literally going to bankrupt the state of Nebraska. And actually, Aaron Parnas just posted a video about how in rural Nebraska, a clinic has already closed, I think in anticipation of this passing, because this state doesn't have the resources to go without what they're cutting in this bill. So Nebraska, where it's done and over.
This Medicaid cut is going to be absolutely devastating, guys. Rural hospitals all across the country are already on life support, and this bill is basically pulling the plug. They are not just trimming around the edges. They're gutting Medicaid funding, and rural hospitals rely heavily on Medicaid reimbursements just to survive. It's not just for people who are on Medicaid. These cuts affect everyone, because when a hospital shuts down, it shuts down for everyone. Doesn't matter if you've got private insurance, Medicare, or nothing at all. If the ER is gone, it's gone. In Nebraska, there's already a rural hospital planning to close, and they're being honest about why. It's because of these anticipated federal cuts, and it's not just one. Over 100 rural hospitals have already shut down in the past decade, and hundreds more are on the brink. This bill could push dozens, maybe even hundreds over the edge. And people don't realize how much damage this does to a town. The hospital's not just a place for emergency, guys. It's where babies are born. It's where cancer gets caught early. It's where your kid goes when they break their arm. It's one of the biggest local employers. It supports pharmacies, nursing homes, ambulance services. When a hospital closes, the entire local economy takes a hit. The whole community suffers. And let's be clear, this is not just about weeding out undeserving people. That is bullshit. These cuts hit working families, elderly folks, people with disabilities, veterans, kids. And even if you don't have Medicaid, your hospital might still close down because it can't survive without that funding. This is what happens when you let politicians treat human lives like budget lines. They're not just cutting costs, they're cutting access, cutting jobs, cutting lives short. People are going to die because they won't be able to get help in time. That's not dramatic, that is reality. And pretending it's anything else is just cowardly and ridiculous. And yeah, this bill might pass in the next day or two, but we better remember every single fucking name that signed off on it, because once these hospitals are gone, they're not coming back, and neither should the people who voted to let it happen.
Nebraska hospital is already closing due to the impending Medicaid cuts. So this news comes to us from Nebraska Public Media. It says Southwest Nebraska Hospital announces plans to close, blames uncertainty over funding. The uncertainty over federal Medicaid funding appears to have claimed its first victim in Nebraska. Community Hospital in McCook announced Wednesday that it will close Curtis Medical Center in Curtis, winding down its operations and services over the next several months. The CEO of Community Hospital said that unfortunately this current financial environment driven by anticipated federal budget cuts to Medicaid has made it impossible for us to continue operating all of our services, many of which have faced significant financial challenges for years. Earlier this week, during a Zoom meeting put on by a multi-state organization, United Today, Stronger Tomorrow, officials estimated that up to 6 Nebraska hospitals could be forced to close if the bill passes. And we all know that bill just passed recently. And they said they have currently 6 hospitals that they feel are in a critical financial state, 3 of which are impending kind of closure and a conversion over to the rural emergency hospital model. Now, it is important to point out that Nebraska is extremely red. I don't know if they realize, but when you have towns of only 1,000 people,
you can't afford to have a fully functioning hospital without somebody subsidizing it for you. So, I hate to say this, but they voted for this. But y'all tell me what y'all think about all this in the comments, and I'll see you on the next one.